Ulcerative colitis. Years ago, you got the diagnosis. They told you you're going to get a potential of getting cancer. I think it's a 1% risk each year. You had it after a certain age, like 20, 25. And now we're using medicine. Does it make any sense to ever have surgery anymore?
Yes. The time frame usually thought of is after 10 years of ulcerative colitis, there is a risk which increases every year of developing colon cancer. In order to guard against that risk, the medication does not protect one from that risk. There isn't enough data to be thinking along those lines. One needs to have colonoscopies performed on a regular basis, at least once or twice a year, and these colonoscopies are a little bit more involved in terms that the number of biopsies that are obtained are substantially greater than a traditional colonoscopy in order to monitor for any early signs of colon cancer. Certain people might not want to go through with that, and for those individuals, having a colectomy does provide them with a good alternative. One group of people who it's not been appreciated until recently need to be very thoughtful with regard to making this decision is young women who've not yet had their families, because data which has only been available now for a few years, and it's unfortunately not fully appreciated, is that for women who have had colectomies, there's almost a 50% infertility rate subsequently. So that has to be part of the informed consent when a decision is being made by that group of patients.
And immune suppressive medicine, like they give by injections today, could that increase your risk of lymphoma?
There is a slight increase. It's definitely there. These diseases themselves have a slight background elevation of cancer among those people who are inflicted compared to those in the general population. And then the addition of these medications, which have been not only life-saving but life-altering for literally hundreds of thousands of people, do carry with it a slightly increased risk, and that's all has to be part of the conversation and communication that you have with the patient when they are starting these types of therapy.